doctor is in. Having a baby is one of the most exciting, life-changing events. And today, we're going to talk about what to expect when you're expecting, and what to expect when your baby is finally born. I'm Dr. Freddy Gomez, and welcome to Med Talk Health Talk, right here on CNN Philippines. You know for sure you're having a baby. You took a pregnancy test, you had a sonogram or an ultrasound. You're jumping for joy, and of course, you'll share the good news with your loved ones. So what's next? Joining us today are Dr. Patricia Com. She's an obstetrician and gynecologist from the Makati Medical Center, and Ms. Amy Padilla. She's a pre- and postnatal yoga instructor from Medicale Yoga Institute. Welcome to the program. So let's start first off, Doctora. What can an expectant mother expect during that first moments or those first few months when she's pregnant?
Each pregnancy is different. Some women really experience nausea, vomiting, dizziness, feeling weak. Some would have a little bit of cramping in the lower abdominal area, but others will not feel anything at all. Although they feel great, sometimes they're a bit anxious that,
Right.
Am I really pregnant? Why don't I feel anything?
Now, Amy, were you able to feel any of these things that
Yeah.
Doctora mentioned?
At the first weeks of pregnancy, I was nauseous. And I think it was driven mainly by hunger.
Oh, okay.
I would get dizzy. It's like throughout the day. It's not even just morning. And I notice I feel better when I eat.
What would the doctor naman recommend for those expectant mothers? Like, for example, would the doctor be recommending certain things like having maybe a flu vaccine or any of these vaccinations
yes.
To protect themselves during the pregnancy?
What is recommended for pregnant women is the flu vaccine, and if she already completed her tetanus immunization in the past, also a shot of the Tdap vaccine. That's the tetanus, diphtheria, and pertussis vaccine. So the flu vaccine is ideally given before the flu season. So now, no, it's already available. Have yourself vaccinated.
Right.
And the Tdap vaccine is given around 7 to 9 months of pregnancy. They're proven to be safe, so why do we give them? Because a lot of parents will be scared of giving vaccination during pregnancy. It's to protect the mother and the baby. The flu vaccine will also prevent pneumonia in the mother and severe cough, cold, and fever, which might affect the baby.
So there's a lot of benefits of
Yes,
being
a lot of
vaccinated while
benefits.
pregnant.
Yes.
Now, Amy, do you think physical activity for those expectant mothers is important?
Super important. I suggest as soon as you get your healthcare provider's clearance,
Right.
because usually first trimester is really rough for some women, and it can be a sensitive time as well. So as soon as they get their go signal from their OB, and it's the second trimester where they feel energized, I really advise keeping strong and fit. There are certain contraindications, of course. There's your body is changing. There's an influx of hormones.
So it is, Doctora, it is safe to do exercises, physical activity, but like what Amy said, limited, and with some care, supervised
Yes,
care.
supervised, and it will also depend on the previous physical activity of the woman.
Yeah.
If she never exercised in her life and she suddenly decides to do intense exercising, she might, her body might get shocked, or she might develop a lot of pain. So it depends also on her previous physical activity.
But moving on, Doctora, what about those who would like to know what the sex of the baby is? I'm sure a lot of mothers, even parents, want to know. Are there any limits or probably guidelines that they should know before they can actually find out what the sex of the baby is?
I see. 20 weeks, 5 months of pregnancy. The gender can already be seen by sonogram.
Okay.
However, there's always the caveat that it's not 100% accurate. Because the ultrasound, it's just, those are shadows. It's
Okay.
not the actual baby we're seeing. And sometimes there can be some mistakes along the way. It's not the fault of the sonologist.
I think that's something important that they should know. How about you, Amy?
I found out at 20 weeks. Actually, it
found
was
out
very
at
accurate.
Okay.
Yeah, but I was worried because sometimes the sonologist told me like we can't really determine for sure because sometimes the position of the baby can
Yes.
greatly affect the.
Okay. Yeah, I
how
think
they
that's
get
something a
scanned.
first-time mother should know as well.
Yeah.
Let's talk about some of the no-nos or what they should be aware of. What are some things, Doctora, that an expectant mother or even a first-time mother should definitely not do?
Okay, of course, number one are the alcohol drinking, cigarette smoking. Also avoid exposure to toxic chemicals. For example, try to limit intake of food with a lot of additives, with a lot of chemicals.
I've heard that caffeine is okay to be taken by some pregnant people, but at certain doses. What's your take on this, Doctora?
Okay, so caffeine, it's still quite controversial. In the literature, it is said that caffeine up to a maximum of 200 milligrams a day is accepted. So that's 12-ounce brewed coffee a day. However, some people may be more sensitive. Some people may be smaller. So probably 6-ounce cup of coffee, brewed coffee a day is acceptable.
Okay.
So even though it's not contraindicated, it can lead to some problems for some women. For example, the baby may be smaller than usual. Too much caffeine intake can lead to preterm delivery. Too much caffeine intake can even lead to infertility. And also it can exacerbate gastritis.
That's right, yes, of
Yes.
course. Now, a woman goes through so much emotional and physical changes during pregnancy, and one of the most common discomforts is nausea. When we return, we'll look at why this happens, and we'll also talk about how we can relieve or ease nausea. You're watching Med Talk Health Talk, only on CNN Philippines. Every woman will have a different pregnancy experience. Some will breeze through their first trimester, while others will suffer from morning sickness because of the increased hormones in the body. And as a result, pregnant women get nauseated, and in some cases, they start vomiting. What we need to watch out for is excessive vomiting, which could be a problem. Now, let's talk about the ways, of course, to help relieve nausea. And still with us are Dr. Patricia Ko. She's an obstetrician and gynecologist from the Makati Medical Center, and Miss Amy Padilla. She's a pre- and postnatal yoga instructor from Medicale Yoga Institute. Now, let's move the conversation towards one of the more common things about pregnancy, and that would be nausea. Amy, did you experience this when you were pregnant?
Yeah, I did. Well, depends on the cause. For me, it was hunger, so I just ate. But for some people, I believe there's this condition called
Hyperemesis gravidarum.
Yeah, there's that also.
Ayan. Since Amy mentioned that, what exactly causes nausea, Doctora?
So yeah, it can be mostly because of the pregnancy hormones. So the hormone beta-HCG, for some women, they're very sensitive to that hormone and they have the nausea, the vomiting. It's more pronounced among women with multiple pregnancies because the beta-HCG is also higher.
Okay.
And it's most pronounced in the first trimester because that's when that hormone is also highest.
Okay.
So that's one of the factors.
So it'll get better.
Most of the time, yeah,
as the
starting
pregnancy
the second trimester, the woman feels great. So it's only in the first trimester. There's some unlucky women where the nausea and vomiting really persists throughout the whole pregnancy.
Okay.
It's also caused by hunger. It can be caused by fatigue. So even though they call it morning sickness, most of the women actually have the nausea and vomiting late in the afternoon or in the evening when they're already tired.
Okay.
It can also be caused by, like the woman is more sensitive to smells, to certain foods. So if she smells something that she doesn't like, or the food is very fatty, very oily, it can make her more nauseated.
So aside from those things, aside from the smell, aside from certain foods they have to avoid, are there any tips you can give those mothers who are experiencing nausea? Some tips on how they could probably avoid it or at least lessen that nausea feeling.
Yes, so be proactive. A woman gets hungry faster.
Right.
So what she can do is, upon waking up, even before she feels hungry, she can already eat probably a banana or something, no, a cracker, right after waking up. Maybe it will help her if she has small frequent feedings, because if she waits until she's very hungry and then she eats a ton of food, then she can develop gastritis and also vomiting, because
Okay.
the stomach also, there's like a portal going to the stomach. During pregnancy, it doesn't close that well. So usually the stomach acid goes back into the esophagus, and
Irritates
it
it a bit
irritates
more.
the esophagus. It can lead to nausea, vomiting, and also heartburn. So she
Okay.
can do small frequent feedings. If she can avoid the foods that can lead to nausea and vomiting. For some people, it's spicy food. For
Right.
others, it's oily food or the smell of probably raw meat. No,
Right.
she can avoid it. She can also suck on calamansi, probably lemon. Others would suck on ice. It can help relieve them. She can drink peppermint tea, like hot water, and then infuse some peppermint leaves.
Okay. How about activities, Amy? Are there any
Well-
activities that you were able to do that helped lessen the nausea?
I would suggest a seated breathing meditation. I mean, it's applicable to everyone at any
Right.
time.
What's the proper way of breathing, since you mentioned that?
I mean, people call it different things from different schools of medicine.
Mm-hmm.
Some people call it 360-degree breathing. Some people call it diaphragmatic breathing. Some people call it abdominal breathing or core breathing. But essentially, you just really want to send your breath, like have a deep breath that's not limited to your chest area, like all the way down.
Okay.
And you want to relax. When you inhale, you want to relax your abdomen and your pelvic floor.
Okay,
And-
but we'll continue
Yeah.
on the proper way to, which is very important for those who are pregnant,
Yeah.
right after the break. And we'll also talk about how important is breastfeeding and the role of the human milk bank. You're watching Med Talk Health Talk, only here on CNN Philippines. All over the world, some 140 million women give birth every year. You'll deliver your baby either by vaginal birth or by cesarean section. Today, we're talking about babies and what to expect when your baby is finally born. Still with us is Dr. Patricia Co and Miss Amy Padilla. Now let's continue with the
Breathing.
way on some people or even the expectant mothers should
Yeah.
breathe properly.
Okay, well, the breath has so many different benefits. When you do the core breathing, it can be a strengthening core restorative tool that I actually advise my postpartum moms. And then, of course, it's a mind and body thing that you can do that will help you with labor as well. So it taps into your a certain type of nervous system where from a flight or fight response, you go into a rest and digest, which I feel is very important when you're in labor and you're in so much stress.
Right.
And
And-
you start freaking out, your hormones, you're panicking. So breathing really puts you in the zone.
And that's exactly where I will go now. It's the time already where the mother is probably in labor. What are these signs, Doctora, that the mother already knows that she's about to give birth or is in labor?
Okay, so the signs are she will have the contractions or cramp-like feeling in her lower abdomen, and also the uterus is sometimes feels like a basketball. It's hard,
Okay.
no longer ballotable, and it comes and goes. So it's not like dysmenorrhea where the pain is continuous, but it's in peaks and troughs. And the pain can already spread towards the lower back.
So
Yeah.
would proper breathing, knowing the proper breathing techniques, be able to alleviate some of these symptoms
Yes.
or help the mother with this?
Definitely.
Yes, so it's important so that when the time for pushing comes, she has enough strength in order to push, and the baby also has enough oxygen, so the baby
Right.
won't go into fetal distress.
In fact, some experts say that 10 to 15 minutes daily of breathing properly, breathing exercises will be able to help with this. Do you know of any concrete breathing exercises, Amy?
There's several. For everyone, just really mindful breathing. you can start with 5 minutes if you can't do 15, because 15 is pretty long if you're
Right.
just starting off. For pregnant women, I would advise, it's called the golden thread breath, where you inhale through the nose and you exhale through the mouth with pursed lips. And you lengthen your exhales, because when you exhale, that's when you relax.
Now, the baby is finally born. So what can these mothers expect? Or what should the doctor advise the newly born babies and their mothers?
So what to expect, of course, sleepless nights. So you will not expect to sleep soundly for 8 hours probably for the first 2 years. Taking care of a baby and breastfeeding is really hard work. It's
Okay.
not easy. Even if she's just lying down and holding the baby breastfeeding, that's difficult.
Right.
Just a reminder to everyone out there that breast milk is liquid gold. Breastfeeding is really a very good way also for the mother and the baby to bond, no? To do skin-to-skin contact. So the benefits are breast milk contains antibodies. It has immunologic benefits. So this is one thing that formula milk can never replicate because breast milk is a living tissue. It's full of antibodies, live antibodies, hormones, growth factors, immunoglobulin A that will help the baby have a good immune system, coat the gut of the baby to prevent any bacteria and any infectious pathogens from entering the baby's gut.
Right.
It has hormones that help still the growth of the baby, the continued growth of the baby.
But Doctora, some mothers may not be able to breastfeed their children for one reason or another, either by illness or just by difficulty trying to produce milk. Are there options for them?
First of all, we try to help the mother, no?
Right.
Most of the time, there's something that we can do in order to help her increase her milk supply. So probably help her in the latch of the baby, give her more tips, make her rest because really fatigue can decrease a milk supply, help her with pain relief because pain also decreases milk supply. Now, there's some medical conditions wherein the mother will not produce enough milk.
Right.
Or the mother may be taking medications wherein it's contraindicated to breastfeed.
Okay.
So what can we do? That's when the human milk bank comes in. That provides pasteurized milk that's really very safe to those mothers who cannot produce enough breast milk for their babies, especially to those babies who are sick and premature and are in the neonatal ICU.
Very good explanation on that. And Amy, were you able to feel the benefits of breastfeeding your child?
Yes. To me, it was just really the most practical choice. I don't have to buy formula. I even just direct latch. I don't have to wash bottles. At night, it's easier. I don't have to go mix the formula. You know, you can be sleeping and just hold your child.
Now, Doctora, for those who might be able to avail of the human milk bank, how long does the milk normally last?
Usually, the milk can stay there for 6 months, but again, we'd never had that problem because there's really a lot of demand for human milk.
Okay.
Yeah.
Now, for you, Amy, were you able to find a good medium or a good balance being able to be an active person like you are and being able to still have a connection with your newborn child and being able to take care of your child?
And the values of yoga is like really about surrendering and acceptance, about the seasons of life, you know? When your baby's an infant, they really need you, like 24/7, they really need you. So the easier for you to accept that, the faster you are to accept that, the easier you will adjust. And, you know, it's never permanent anyway. Now that my baby's 2, I can go out more, I can teach more. But the first, because I'm an exclusive breastfeeder, I was really attached to my baby.
Can we have a message first from Doctora?
It's important to get a good support system, trust your doctor, find a good obstetrician, find a good hospital where you feel comfortable and confident that they'll give you the best care, know the basics about breastfeeding, and accept that we are only human, even though we call mothers super moms, but we know when to say that we're too tired, that we need help, or breastfeeding is not working, so immediately ask for help because we also encounter women who develop postpartum depression, for example. So we have to intervene early.
Now, Amy, do you have some tips or advice?
Tips, get active, get physical as soon as you get clearance from your doctor. It will help you prepare for a good birth and also faster recovery when you seek out an active lifestyle during pregnancy. And when you're recovered faster, you're more able to tend to your child.
And with that, I'd like to thank you, Miss Amy Padilla, for sharing your experiences. And of course, your advice and tips, Dr. Patricia Ko. Thank you very much
you
from
so
the
much.
Makati Medical Center.
Thank you.
And with that, we'd like to thank you for joining us, and we'll see you again next time as we give you topics that help you take control of your health. Thank you for watching MedTalk Health Talk. I'm Dr. Freddy Gomez, right here on CNN Philippines.